This conference will now be recorded.
Excellent. So, we have slight changing. I seem to think we go straight to slideshows. I'm going to flick through the slides with them on the screen, and you can see them down the side. Apologies, I don't know what's happened there with my computer. So welcome to the third of the weekly webinars, which summarize the findings from the WhatsApp group, everything that's been shared. We've got quite a lot to share in today's one. We'll do our best to keep it to 15 to 20 minutes probably. So without further, and as always, the slide deck will be shared at the end of this webinar. We do this twice a day, so we'll actually share the slide deck at the end of the day after we've done the second webinar for people who live on the west side of Europe. Where are we at today? Well, here you can see the COVID group on a page. We've continued to grow over the last week. So this group now encompasses 169 different organizations, mostly water utilities, but it does include some non-water utilities and also some regulators. The group has representation from 33 different countries. In the first week, you might recall there was a lot of sharing around well-being and sort of lone working practices. And then last week, the discussion had moved to much more operational and asset management type issues. What we've seen in this third week is much more detailed questions, much more specific questions to the water sector. I'll get into those in the next few minutes. But before we do, I thought this was one of my favorite graphics shared during the week. And it came from Mohammed at the Alain Distribution Company. And it was really a great picture of where do I want to be during COVID-19, and as we all move through this sort of fear to learning to growth zone. I'm aware that this graphic has actually been used in the HR departments of a number of our members. So, and I've seen someone say, can I put my PowerPoint into presentation? Unfortunately, for some reason, the system's crashed and it's not letting me do that. So apologies that I can't make this bigger. There's something that's not quite working here. I'll just have another go, see if that works. Sorry, I was looking at the questions that were coming at the same time. So there's that very useful graphic that's been shared, and you might want to use that within your organizations. The themes for today, the sort of agenda is, as previously, we'll work through the key questions that were raised by the group and their responses, and we split those into asset management and operations. What we've also got is a section that my colleague Matt Stevenson is going to talk about on technology outreach. So last week there was interest in us trying to do things around technology and look at some of the technology solutions. And so we've actually taken on a bit of a task there to look at that. Then Matt will hand back to me and I'll wrap up by talking around some of the pending questions. So if we come to the first question, and we've got the first 3 or 4 questions are specifically around operational type issues. And this first question is around face masks. So it's continuing the PPE discussion that we've had in previous weeks. And what's interesting is there's now a bit of a debate about, are face masks even necessary? Are they, there seems to be some places where people are saying, if you haven't got the symptoms, don't wear a face mask. And I think there's a sort of common sense piece that comes through all of this, which is that clearly if you've got PPE, you should wear it. If you don't have it, then there are things you can do to reuse them, to wash your face masks. And actually, if you haven't got any PPE even to sort of reuse, then keep your distance and use sparingly what PPE you have got for those people who are exhibiting symptoms. There's a sort of common sense angle to this, but clearly the message is that if you've got it, use it properly. And there's some links there. As always, we've included the links to other sources of information. The second question that came up was around sampling and testing for drinking water and wastewater sampling. Yeah, are people sticking to their regulatory requirements, their regulatory regime? The responses have actually been very variable. We've got 2 slides here on this, capturing some of the responses that come from all around the world. The responses seem to be very variable, with people doing slightly different things in different regions, and varying between regulators. So there's different responses depending on the relationship people are having with their local regulator. There does appear broadly to be some easing on the wastewater sampling. If anything, that's where people are perhaps easing back a little bit. But most people are working hard with their regulators to come up with an appropriate regime. And if I flick to this one, what you can see here is actually in South Africa, they're taking less samples. But here there's this second bullet point down here. There's a really interesting point that they are still inspecting stormwater outlets, and actually they are issuing non-compliance notices. So trying to stick as much to a business as usual as possible, which obviously seems like a very sensible approach. The third question which came up was around mental health. I think we're all experiencing this within our own organizations, and as the lockdown continues, I suspect we're all getting our own personal sense of slightly going insane as we work from home and do everything via Zoom and Skype. There are various suggestions, and some good resources have been shared on this, as you can see here. I particularly liked here what they were doing in Gippsland Water in Australia with their peer connect programs. That seemed like a great way of just sort of making sure that people had someone they could lean on as they go through these difficult times. The last of the operational questions was around the presence of COVID-19 in wastewater. Now, this has been a recurring theme on the WhatsApp group, and you might remember that at the very first week, there seemed to be good evidence that COVID-19 was killed in wastewater. Then there was some research coming out of Amsterdam, which suggested that actually maybe there was part of it that was surviving, and that then moved to research into actually it's not the disease, the virus is not active through the wastewater process, but it is an indicator. That story has continued over the last 5 to 7 days, and actually there's some good research summarized here. The overall message stays the same, is that current disinfection conditions in both wastewater treatment facilities and in drinking water facilities are doing the job. All evidence suggests that there is no increase in risk to either our customers or our staff, that what we're doing in the conventional wastewater treatment processes kill the virus. What is quite interesting here is this first bullet point here from this virological assessment of hospitalized patients, and this actually showed that the virus, the RNA bit of it, is surviving in the stools, but not in the urine sample. So it's obviously associated with the solids. I think, again, it's a bit like the question around the PPE. As long as people stick to their standard procedures and follow good hygiene practices, there should be no increase in exposure in water and wastewater treatment works. Moving on now to some of the asset management related questions. The first one of those was around remote operation. Basically, it was a question that came from Gippsland Water, from James at Gippsland Water, around how much are people responding on remote monitoring and digitized, how much have people digitized their operations. Had some great sharing here with different examples, and you can see them summarized here from Australia and New Zealand and the Philippines, of people having done different things. I particularly like this comment at the bottom of this first paragraph from Wellington Water, where they were applauding the investment that had been made in their digital infrastructure, because you know what, despite what people may think, and this is me quoting him, operators are not on their game at 3 o'clock in the morning. So the more you can automate things, the better. The takeaway I took from this was that in general, people are quite comfortable having, if they've made the investment into automated systems, you can run most facilities for 2 or 3 days. The longest anyone seems to have stretched that out to is 5 days. And for obvious, good, sensible reasons, what in an ideal world, we want to be visiting these sites much more frequently to deal with any emergency situations that might arise. We then come to customer focus questions, and there was a broad question that came from our friends in Italy around initiatives to help customers as they need to pay their bills. This problem is clearly only going to get more challenging as the epidemic continues through the next few months. And I think everybody is acutely aware of the people in society, in particular the poorest in society, who are going to struggle to stay solvent on a personal level, let alone on a corporate level. The systems that are out there seem to be varying. The offerings that are coming vary from country to country, and that sort of makes sense because countries are at obviously different phases in the outbreak. But there's a general attitude of helping the poorest in society, either the poorest as in the poorest people, or indeed the poorest or most vulnerable businesses, which is the SMEs and the freelancers. It's actually referred to here in Spain. They refer to them as the freelancers. So there's lots of different examples, and there's various links here to what's being done. We didn't try and capture it all on the slide, but if you want to see the individual country by country bits, it's useful to see. I thought these last two were particularly good to refer to, because obviously in Ireland, water for domestic customers is funded from central taxation, and so it's essentially a nationalised water treatment water system. And in Ghana, actually, the government has decided that it's going to waive bills for the next 3 months. So the whole business has been changed there. We now move to a question on demand predictions. I'm slightly worried that my computer screen, there we go. Hopefully that's shifted for you. Yeah. So the last of the questions that we're going to look at in detail on this webinar is around demand prediction. Again, this is not surprisingly a theme that's occurred quite a lot over the last 2 or 3 weeks, and we're now beginning to get real data on this situation. So Anna Lundmark from Hunter Water in Australia listed out some very specific questions here around how have people seen their industrial and commercial customers changing both in a negative and a positive way. And there was various responses. And I think this first link here is on the shift in demand patterns, which was shared by Eric Driesen in the Netherlands. The link is actually in Dutch, but it's very easy to translate using Google Translate. And basically, it says, you know what, with everybody working from home, the water usage actually hasn't dropped. If anything, it's gone up slightly. What has happened is people are using water at slightly different times. There's been a shift in the pattern, and the peak has moved from early in the morning to later in the morning. And the article actually makes a comment that it looks like people who work from home stay in bed a bit longer. It's not rocket science, is it? What's interesting was this last comment from Madrid, from Canal de Isabel. They noted that the peak had shifted from 7 to 8 in the morning to 10 to 11, and that there'd been an overall reduction of 9%. Now, actually, if you think about, in general, a water utility probably has somewhere between 20 and 25% of its water going to industry, and industry has probably shut down by about 50%. That reduction of 9%, I suspect, links to commercial customers rather than changes in patterns for domestic customers. And it would be really interesting if anyone's got anything to sort of substantiate that. There's a second slide here, continuing on that question, and this graph shows a really interesting sort of little dip there that you can see at 8 o'clock in the evening. And it's noted that 8 o'clock drop, again, this comes from David at Canal de Isabel, is, we think, a reflection because everybody's out there clapping at their windows in recognition of the healthcare professionals. I know that that's been done in Italy. We're doing that in the UK on once a week. And I don't know whether that's being done elsewhere, but it's sort of I actually thought that was a positive moment, a sort of smile moment out of all of this, that you could see an overall reduction in water usage because people are busy doing something else, and something quite nice. There are some other general questions which have been picked up. So there's one around Legionella in in-house water systems and the potential sort of increased risk of that. There's some stuff around disinfecting and decontaminating households and standard procedures for it. And then there was also a question on meter reading and how people go about doing it. I won't talk about those here, but you can see the responses and the links on this slide deck. What I'm now going to do is I'm going to hand over to my colleague, Matt Stevenson, to talk about the work that he's done in the last few days, looking at the technology outreach. And just to put that into context, last week there was interest in saying, well, actually, let's look at some of the technology solutions. Can technology help us out of this? And so we and Isle said, well, we'll do a bit of an outreach for that. Matt, can I hand over to you?
Yeah, thanks a lot, Piers. I think I'd add to that we actually had a few technology companies approaching us to see if they could offer their support to water utilities. So that in part created this demand, or we felt there was a demand to go out to technology companies to see if there were others that were keen to help and support water utilities around the world. So our outreach was very open. We asked the question, do you have a technology that could help the water utilities manage the effects of COVID-19 with very, very little framing of exactly which challenges that might be coming up, and tell us how your technology could help. And our outreach went out to around 2,500 technology companies, plus it was posted on LinkedIn with a few thousand views. And from that, we received more than 50 qualified responses from technology companies. And technology companies are, in essence, any organization that is part of the supply chain within the water sector. And you can see that we've categorized the responses that we had back into 4 main areas. The first one, and they're on the left-hand side of the slide there, detection and testing. Is a clear one. Removal or deactivation of viruses in water and wastewater, and then technologies around remote monitoring, remote control, and resilience. As Piers has already mentioned, I think quite a few water companies are quite far down that journey, but there were a good response around companies wishing to offer their support in that way. And in general, the enthusiasm and the level of response from organizations from across the globe was very, very positive. And I think there's a strong desire to offer help to you guys who may be dealing with challenges that are new to the industry. Just a caveat around what I'm going to go through next. None of the technologies have been verified by us. It is what we normally do, but this is a technology outreach. So these are the pure results that have come from that, rather than these aren't companies that we've gone out to seek. Okay, Piers. So I've got 4 slides, and each slide has got the same format. I've just I've categorized the different types of solutions there, and what you can see on the bottom left-hand side is the companies that responded. And I would say, if you recognize any of those companies or you've worked with them before, it's definitely worth reaching out to them, saying hello, and mentioning that you've seen this, that they've responded. I think it's difficult times for many parts of this. So here's we got a real range of solutions being proposed for detection and testing for viruses in water and wastewater, all the way from rapid portable tests, online analyzers, all the way down to laboratories offering their services to test water and wastewater. So there's quite a wide range, both water and wastewater. So perhaps the testing is going to be very different on those, but our takeaways from looking at this are that there's a real need for technical verification for testing and detection technologies, because very, very few are set up and proven to be able to measure and detect SARS-CoV-2, which is understandable because this is a new virus that hasn't been around for very long. But that's something that stood out, and we would normally recommend that there's further investigation into how these technologies work, and perhaps a desktop verification that they work, and then moving that on to some sort of real world testing, market testing. So that was detection and testing technologies. The next one was around removal or deactivation of viruses. And again, exactly the same format. There's the list of companies that responded, had a very good response for this. I would say the range of solutions that were offered were very wide. We had some technologies that claimed to be able to remove pathogens and remove viruses, and then many that were deactivating viruses, UV and ozone technologies, which probably most companies are familiar with. But then there's some real novel ones there, UVC disinfection at the point of use of drinking water. So the takeaways that we had from this one, again, most technologies are not yet verified for SARS-CoV-2, but I think it's not a big stretch to expect that, and I think we've discussed this in the previous slides, that as there's proven technologies to remove viruses and deactivate viruses, it shouldn't be a big stretch to expect that SARS-CoV-2 could also be deactivated. Clearly there's, and Piers mentioned this, is an emerging link between viruses in wastewater and societal levels of transmission. So here we have some options that may help with understanding that, and that's something that we see many of these companies keen to be involved with. And then the last point really is about ionization, and whether there is there can be a risk of airborne viruses, particularly on the wastewater treatment work, if it's in the wastewater. And there are technologies out there that can purify the air and remove the risk in the air. And there's a question there whether or not the risk for airborne contamination has been considered for water operators. Okay, and so then we looked at remote monitoring, control and resilience. Is quite a wide bracket, this one. And as you'd expect, we got a really wide range of offers around providing support. The example I've put on the screen there is Ziptility, again, unverified by us, but the claim from this company is that they can get you working with your works management remotely via iPads and iPhones in 2 days. So I think there's some really interesting potential options. I appreciate that, you know, most water companies will be on a different journey for remote monitoring and control, but there's some really interesting options there. Imagine doing site surveys, site safety surveys from aircrafts. That's the kind of option that's out there. And then in terms of resilience, there are pumps that avoid ragging and clogging when everybody's flushing their disinfectant wipes down the toilet. So again, a really wide range of solutions. What we see is that some of the solutions being offered here could be real long-term options that could be beneficial beyond this pandemic. And I think that's obvious, but I think it's certainly, if things can be implemented quickly, that would be a real benefit to a water company. But clearly there's a question about how quickly some of these could be implemented. And then the last category that we looked at was around contingency options. Again, this had a real wide scope. so there's a couple of software providers that are offering their software for free at the moment. I've put one on the screen there, which is Noggin, an Australian company. And if you go on their website, you'll see that this is a solution that is not specific to the water sector. It's around any type of incident management. It may be worth having a look at if you feel that your organization is actually in an incident. I don't know if that's been declared in most places, but that's an interesting one, and they're offering that for free at the moment. There are a couple of other software solutions that are being offered for free. We also have some more practical solutions in there about emergency water supply and the introduction of how to introduce water into the network through particular types of fire hydrants. So I think the takeaway, the key takeaway from this is that actually we need more contingency options to come from the supply chain. And I think this is perhaps where the supply chain needs more guidance to say, these are the parts of our operation where we could really do with some help. So that would be the kind of key takeaway. If we could provide more direction for the supply chain, I think there are lots more solutions out there that could be very useful. And that was the extent of the outreach, Piers. I'm passing back to you.
All right. Thank you for that, Matt. So I'm aware that we've bumped up at the half-hour section now. Just a couple more minutes to wrap things up. So we've included here some of the pressing issues that are under the unanswered questions. There's obviously quite a lot of questions now in the WhatsApp group that are constantly being raised. The two that we'd like to flag here is, how are other administrators and public and private companies dealing with the ongoing hydraulic infrastructure projects and site works, i.e. what are you doing with your capital program, and how's this affecting the rollout of your capital program? And then there was a question here which I think was directed specifically to the UK, as it says in the introduction, and it's, how are you getting on with your discussions with the regulator regarding additional expenditure or change in expenditure as a result of the epidemic? So it'd be good to have some thoughts around that. As always, this slide deck has the links to the shared resources, the daily go-to, the webinar, and the interesting read. The interesting read here is from a paper in Italy, where they've actually found the correlation between air pollution and mortality in two of the worst affected regions of northern Italy. Now, that doesn't particularly affect us directly in the water sector, but it's a really interesting, as we go through this epidemic, we're learning more about it. There are then obviously, as I flick onto the next slide, links to other shared resources on research and interesting reads. And then we've got some offline resources, which if you need access to. What we've also done in this webinar is, at the very end of this slide deck, we've included all of the resources from the last two seminars. So if you're tasked within your organization of sort of trying to summarize where we're at with COVID, all of the resources are now included in this single deck. The next steps, well, obviously, if you want to develop any of these topics further, please do not hesitate to contact either myself or Charlotte DeWitt. Charlotte does a huge amount of the work for this project, and I'm incredibly thankful to her for everything she does. She's been living and breathing this 24 hours a day for the last 2 or 3 weeks. So thank you, Charlotte. I'd also like to flag on the building on the technology outreach. So over the last week, we've spoken to a few of you about the work that we've been doing on the technology outreach, and there's been I think people appreciate that what we've done within ISLE at the moment is a sort of initial outreach. I'm nervous to say this because it looks like we're sort of trying to sell a project, but actually there is a piece of work that's required, I think, to dig deeper into this. Actually, while we've been talking, there's been a question come up about the air ionization and is it a valid science? And I think that's exactly the question around the validation of some of these claims that are coming from tech firms. What we are proposing is to try and do a deeper study into this. And I think that we'll pull together a proposal over the next couple of days and maybe circulate it around you. The idea being that if we can get a consortium of 30 or 40 utilities coming together, the cost per utility can be very, very small to try and get into some of the detailed technology outreach. So please watch this space. We will send you something for hopefully you to consider, because it feels like this is an important question that needs answering. The next webinar will be in a week's time. Certainly in Europe, we're celebrating Easter, and I wish you all a very happy Easter if you are celebrating Easter over the next few days. Please keep safe, keep well, and hopefully reconnect with you in a week's time. Thank you for your time.